Hey, good to see you.
You too.
Hi, I'm Jessica Cording. I'm a registered dietitian and health coach at Valley Mount Sinai Comprehensive Cancer Care.
And I'm Suzanne Kaufman. I'm a licensed clinical social worker at the Valley Mount Sinai Comprehensive Cancer Care.
And we wanted to talk to you today about self-care for caregivers. We know that it can be an incredibly stressful experience to be caring for a loved one, and that it doesn't always feel easy to take care of yourself. So today we wanted to answer some questions from our community. I'm having a hard time balancing everything and feel guilty for being tired and stressed. Is this normal?
Yes, this is very normal. Being a caregiver is a hard thing to do, and it's very normal that you're going to have a lot of feelings about it. You're going to feel tired, stressed, and even possibly feel guilty about having those feelings. Caring for your own needs for rest and relaxation is important, but easier said than done, right, as a caregiver. So here are some tips. Use some positive self-talk. If you say, I'm always tired and therefore I can't get anything done, that's sort of a more negative and hopeless outlook. But if you say to yourself instead, I feel tired right now, but tomorrow I've scheduled some time for myself to do something I enjoy, you'll have a more hopeful way of feeling and you'll kind of move past those feelings. And if you do want to focus on those feelings that are negative and acknowledge them, there's nothing wrong with that either. Maybe just schedule some time, 10 minutes, to acknowledge those feelings, not during rest time or meal time or bedtime, but just to let yourself feel those feelings and then kind of move on from it.
I'm a big fan of scheduling that worry time.
Yes, I think it can be helpful. How can I eat healthfully even when I have so little time and energy for cooking?
It can be really easy to fall into unhealthy eating habits when you're in a caregiving role. I mean, you have less time for cooking, shopping, your energy's not what you're used to, and let's not forget stress. That can play a big role in eating habits. So this is really a time to focus on the basics of nourishment, not on being perfect about healthy eating or doing all the things, but really bring it back to just stable blood sugar. And by that, I mean eating a balance of protein, fat, and complex carbs at your meals and snacks spread evenly through the day. This is important because it helps keep our energy stable, it helps support a more stable mood. It's also been shown to play a really important role in our body's stress response. Make it as easy and convenient as possible to eat well. Maybe you take some time on the weekend if you have it to prep some healthy things, or you take stock of your favorite healthy takeout options. Embrace healthy shortcuts too, whether that is pre-cut and pre-chopped produce, frozen vegetables, things like that, or again, things that are semi-prepared or healthy meal kits that you enjoy. This is also a time to be mindful as well to prioritize hydration. Even when we're mildly dehydrated, we can feel more sluggish, irritable, have a harder time focusing. And additionally, be careful with alcohol and caffeine. Because when we have too much of those, they can really negatively impact our energy, our focus, our mood. So drink your water. This is a good time to focus on hydration. So what can I do to feel less burned out? It's a big one.
Mm-hmm. So try to find some time for yourself, even a few times a week, which as a caregiver can be a challenge. Finding activities that promote the release of positive hormones that make you feel good is important. Going for a walk, doing things like cooking, dancing, spending time with loved ones, spending time with a pet, definitely being out in nature. These are very restorative activities that can help. Anything that nourishes you, physically, spiritually, or emotionally, you deserve this nourishment as much as your loved one that you're caring for who's going through all of this. Laughter is very important. Watch a funny movie, read a funny book. Laughter can produce positive endorphins that can make you feel better.
Yeah, good time to binge watch all the funny shows.
Exactly. I'm so stressed out, it's affecting my sleep. What can I do to get better rest?
Yeah, sleep is, it's frustrating, right? Because we hear about how important sleep is to our emotional and physical well-being. And yet when you're really stressed out and anxious and busy, and when you're a caregiver, it can be really hard to get that quality rest. Maybe your sleep is disrupted because you have to get up several times through the night to care for your person, or you have a lot of stress that's on your mind and just circling at night. Or, maybe you're trying to squeeze in work or chores either early in the morning or late in the evening. A few of the very helpful things, just basics of sleep hygiene. Keeping the sleeping environment cool, dark, and quiet. So for example, the dark is especially important because we are surrounded by screens all day, every day. And when we're exposed to screens at bedtime, so things like tablets, phones, TVs, laptops, computers, that impacts our melatonin levels, which is a hormone that plays a key role in regulating our sleep cycle. So when we are exposed to light, that sends signals to the body that it's daytime. We should be doing daytime things, not resting. It can also help to establish a set sleep and wake schedule when possible, just to get your body used to going to sleep and waking up around the same time. And again, this is a time where even if you maybe not be getting enough hours of sleep or as many hours of sleep as you would like, doing what you can to make your sleep environment conducive to restful sleep can help you at least enjoy good quality rest. We do a lot of processing in our sleep, and it's not uncommon to find that your thoughts get on a loop, an anxiety loop in the middle of the night. Something that can be really helpful for this is writing down your thoughts in a journal that you keep by your bed, or you can write it right before bed. Just do a brain dump of all the stuff on your mind. It can be very helpful. And mindfulness is also a really helpful tool for this kind of stress management and for calming the body for sleep, whether that is getting ready to get in bed or whether that is when you wake up in the night. So mindfulness, it could be meditation. Meditation, we have lots of research on the mental and physical benefits, especially for stress reduction. With meditation, that could be a minute of deep breathing or just a few minutes to just calm your body and brain. And mindfulness can also be moving as well. Anything like taking a walk or doing dishes or having a snack or hanging out with your pet. When done with intention, these things can all become a mindful exercise.
And it's like getting out of your head and into your body and kind of just giving your mind a little mental break.
So important.
Yeah. I don't have as much time for the gym right now, but I want to stay active. What should I do?
Yeah, this is a big one. Because yes, we know that exercise is also a really powerful stress management tool, and yet when you have less time to go to the gym, it can be really frustrating, especially for people who are used to being active. Suddenly having to figure out a new routine can feel really daunting. A few really important things to keep in mind. Similar to with food and nutrition, this is not a time to put tons of pressure on yourself to do a really complicated routine. With exercise, research shows that even a little bit can be beneficial. So if you don't have 30 minutes to go to the gym, maybe you do 10 minutes, 10 minutes a few times a day, or even just 10 minutes just to kind of clear your head, get the blood flowing, clear your mind a little bit, can be really helpful. Just make sure that with exercise, it's something that you enjoy and something that realistically fits into your day-to-day life as a caregiver. Where can I find more information on caregiver resources?
Sure. So a great place to start is with the social workers at the Cancer Center. They can give you resources for caregiver support for you and your loved ones. And then at the end of this video, we'll list some national websites for organizations that provide caregiver support. It's all free. It's accessible to anyone. And studies about resiliency have shown that resilient people don't go it alone, and that they do get support that's available. So we really encourage you as caregivers to go and get support for yourself to get through this, to give you the support that you need to do the very important work as a caregiver that you're doing.
Amazing. Thank you all so much for watching. We hope you found this helpful. And again, I am Jessica Cording.
And I'm Suzanne Kaufman.